Connect 5 is a training programme for our frontline non-mental health staff to equip them to have conversations about mental health and wellbeing, and to, when they come across stress and distress, to be able to intervene effectively to help people help themselves or help people get more help. Because of the sort of stigma around mental health and the over-medicalisation, a lot of our frontline staff don't feel they've got the skills or the permission to get involved with people's wellbeing and mental health. And I think as a result, lots of people are left in silent struggle. So I think the contribution is to really empower our frontline workforce that have got that opportunity and having conversations all the time to actually play a part. And I think that the evidence shows that workforce are up for that and willing to do that. Train the Trainer works by training a group of people that have got the resources or the assets within their role or their area to roll the training out. So we work through a local lead who gathers together those people, and then we deliver the training directly to them, and then a 2-day Train the Trainer module, and so they're equipped and confident to roll out that training in their locality.
I was actually approached by my line manager, who said that there was a sum of money available from the CCG in Fylde and Wyre, and they were looking to pay for somebody to deliver the training specifically in that area by way of a secondment. So 3 days a week I've been delivering the training now for over a year. I've actually trained 251 people.
We deliver projects across Tameside, Oldham and Glossop, where we're helping people either in their personal life or in their professional life to support people with mental health needs, and this is a great practical course that we identified that we thought could really support our work as a community charity.
Through my role as a support worker, I was already delivering dementia training to carers, so it fitted quite well with that to expand that training role.
I think mental health prevention is really about access. One of the challenges, I guess, in any system is that we can have services and different workers working in different boxes, different parts of the system that don't really communicate. So instead of necessarily feeling that everyone should go to specialist service, which of course is impossible because of waiting lists, etc., that means many people with mild to moderate problems often get very little until they become worse. We need to have everyone, wherever they're working, podiatry in the community, in the voluntary sector, in health and social care, being able to communicate and link, build trust and talk about the impacts on people's lives, and have easy access locally to where people actually are.
When you look at the ambitions that there are for scaling up the workforce for mental health and the directives that there are around improving public mental health and access to wellbeing conversations, we really need to be getting in Connect 5 and the skills that are entailed within the training programme into early training programmes, both core professions and pre-registration training, but also the voluntary and community sector.
It's definitely changed my practice and the Lancashire wellbeing teams, because I did all our in-house training as well. So 90 of the wellbeing workers are all using Connect 5 strategies with their clients, and we get 1,400 referrals a month. So that's made a huge difference to the practice of myself and my colleagues.
I think it's a really good course because it really reaches people in a sort of an emotional way as well as in a skills way. So people move forward in their attitudes and their behaviours surrounding mental health, but they also come away with confidence and some skills that they can put into practice in their day-to-day lives and in their work.
Well, I think the Connect 5 rollout is really very significant. It's a major investment. We're looking at around about £250,000 worth of investment, and that will go towards looking at the health and care services, not just NHS providers, but the whole of the mixed economy of providers. And that really, I think, is showing significant investment and ambition that we can deliver healthcare across the whole of the population, not just for people that manage to get into specialist services.